Hello, 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 YouTubers. Shannon the Lock Nurse here with a completion of another semester of FNP in Nurse Midwifery School. All right, y'all. I had 3 classes this semester. We just got final grades. Today is Christmas Eve 2024. And I had 3 classes, 3 credits each, so 9 credits. Primary care for adults. We had special populations, so geriatric population, things like that. And then the FNP practicum, which is your clinical hours basically, and like a few assignments in that class, soap notes for sure. So in those classes, we have the clinical hours. So in that, I had 2 sites this semester. I had harm reduction, which was street medicine, like community, like a mobile office, also clinic situation, which was very neat. And then I also had child psychiatry, which was an inpatient consult team. And I will show you my markdown. All right, there goes my baby. Hey, Mills. Okay, this is my program plan. First semester, second, third, and just completed the 4th. So that was the last 2. We had the clinical hours. So the 168 and 168. And then now for the final one, we have 224. And then that will be the completion of my MP program. And then the final 3 semesters are my nurse midwifery program. So yes, y'all, progress is being made. Okay, so the primary care and special populations class, both of those lecture, taking notes, trying to connect the dots for things. So it's like not as challenging as in prior semesters because now things are starting to make sense. And then the clinical settings are where I feel that I'm finally connecting the dots. So I'm knowing what medications are used. I'm knowing what to look up and what to check for. So like with the child psychiatry clinical site, that is specialty for sure. So delirium, catatonia, self-harming behaviors, Tylenol overdoses, you're seeing liver failure, transplants needed, suicidal ideations, actual suicide attempts. So yeah, that is like, okay, what are we gonna do? I like that site because it's different from anything I've done in nurse practitioner program as well as in nursing. So while I have some experience with psych and, dementia, things like that in the long-term care setting when I was an assisted living nurse, this is totally different in the child psychiatry rotation where it's all families, it just depends on the situation. So that's different for sure. I like the team there. So it's similar to my current work environment where we have a nurse and a social worker. So same thing for that site is a social worker and a nurse practitioner. Sometimes they're peds, sometimes they're family nurse practitioners, but yeah, that team works really well interdisciplinary wise, just with their background and what they bring, nursing and social work. So I love that. So that was good to see in that environment. Knowing like Ativan challenges and things like that, that's something I would have never seen in another environment. So yeah, it was enlightening. Psychiatric interviewing is enlightening, and I did do some myself. Yeah, I was just like, whoa, I did that? Okay. When you're writing the notes, it's not like a typical soap note, with the impression and history, especially with child psychiatry. You're going into like developmental delays and just a lot of history. History for soap notes as well, but a lot of history for the child psychiatry notes. For my street medicine and harm reduction rotation, that was like where I really saw the dots connecting for like Hep C treatment, STIs, wound care. In that rotation, I wasn't sure how I was going to do in it as a child of substance misuse. So yeah, I did really well with it. It was fine. It's something I know personally. It's it is what it is. Mental health is a huge thing. It's a huge area that a lot of people don't have help in, or they're too prideful, or there's just sadness around it. Families don't understand or accept it. So that rotation was like enlightening in the aspect of, I'm from Detroit, I'm from the hood, I'm from Schoolcraft, whatever. I saw a lot growing up. Again, a child of substance misuse in my household. Had a lot of support, and we would probably call that one a functional, but it doesn't matter. The children still see everything. So to see people your own age utilizing IV drugs and not being able to cope and not being able to seek assistance, leaving their children, it's hard, and it's hard to see as a mom. But helping them when they want help, meeting them where they are, so like we can have a conversation. They may want help at minute 2 of the conversation. We working on it at minute 5 of the conversation. If it even lasts that long, they may no longer need help. So not taking things like that personally, and having that background was like, okay, that's fine. Doing xylazine wounds, that was rough. Just because the wound semi looks necrotic, some of them, but they're not. And seeing the participants, the patients that we serve, seeing them try to keep it clean. Some people are still like shooting up in the wound. And then some people get the wounds and they're not even IV drug abusers. It's the xylazine that's in the substance. So it's like, sheesh. I found out a lot at that rotation. I'm knowing how to, again, prescribe a lot of the things. And it was like, you're not going to the app. You're not like going on the IV, on the websites. Like, you know what you know. So it's like, okay, I'm connecting the dots. So it's like, I felt good about that. But yeah, those rotations were very enlightening. I could see myself in the harm reduction and substance misuse field for sure. That's not all I would want to do, of course, but as a specialized position, yeah, I could see that. But yeah, y'all, I finished my 4th semester in the nurse practitioner and nurse midwifery dual program. I have 1 semester to go. I have looked at a couple other YouTubers who just finished and are nurse practitioner students, and I did purchase Picmonic, and also there's a FNP study guide on Etsy. I believe Safia, I can try to link her. I've been watching her videos. She put me on that one, so I purchased that. It should be coming from Etsy on Friday. And Sarah Michelle reviews, I printed some of her stuff. But yeah, finished the semester, y'all. Again, if you watch my other videos, you know my husband passed earlier this year in February. So this is our first holiday without him. I'm more than halfway, almost done with my program. Our support system is amazing. I'm knocking it out, y'all, with their help, with the Lord, with my angel, with all the ancestors. I've had a lot of losses over the last 4 years, so yeah, doing the best I can, y'all. Leave comments, leave inspirational quotes, leave whatever you like underneath, and I will get back on this video. I will get back on with another video. The Echo Core 500 that my sister and my sister cousin got me, I haven't had the opportunity to use it, so I'll make another video for that as well. Peace, y'all. Happy holidays, and we gonna be all right. Peace.